So welcome to today's Seaside webinar, Libraries as Partners in Health, Nashville Public Library. My name is Liz Waltman, the Outreach, Education, and Communications Coordinator for the Southeastern Atlantic region. Before we begin with today's guest speaker, there are just a few administrative things to cover. As you are sharing, communicating, and asking questions in the chat box, please be sure to send to all attendees so that I, our guest presenter, and your colleagues can see your questions and information shared. Elizabeth will answer questions as they come up throughout the session, but there will also be time at the end to ask our speaker any remaining questions. If you need closed captioning for today's webinar, I'm going to post the link to that in the chat box now. This is also the same URL that you see on your screen. Let me just put that in the chat box for all of you. There it is. So today, we welcome our guest presenter, Elizabeth Roth. Elizabeth coordinates the Be Well at NPL initiative at Nashville Public Library. She has close to a decade of experience managing the activities of public and private health grants, from providing HIV testing in nightclubs to running clinic-based quality improvement programs. When establishing community partnerships for NPL, Elizabeth loves hearing the health service sector exclaim, "I've never thought about doing this at the public library, but it just makes so much sense." So before I pass this over to Elizabeth, let me just provide a little bit of context framework for today's webinar. This is the first in a series of periodic webinars highlighting the experiences of libraries providing health literacy outreach using funding from the NNLM All of Us Community Engagement Network. The NNLM All of Us Community Engagement Network, or CEN, characterizes the partnership between NNLM and the All of Us Research Program. This partnership leverages the role of libraries in their communities as trusted information providers. The purpose of the CEN is to help public libraries support the health information needs of their users by providing funding specifically for programming which helps promote awareness of the All of Us Research Program. And just one final piece of background information for you, just a few points about the All of Us Research Program. So the All of Us Research Program is an initiative by the National Institutes of Health, and it is asking for 1 million participants from diverse genetic backgrounds, lifestyles, and environments to contribute their health information to a large biomedical data set. And the ultimate goal of the All of Us Research Program is enabling research on more precise, individualized medical treatments. And with that, I will pass it over to Elizabeth.
Thank you, Liz. Good afternoon, everyone. My name is Elizabeth Roth, and I coordinate the Be Well at NPL program at Nashville Public Library in Nashville, Tennessee. And my goal today is to share with you about our library wellness initiative and highlighting some of our programming, resources, and a recent staff training in collaboration with Vanderbilt's Biomedical Library. And many of the resources that we use are from National Network of Library Medicine, so I am excited to be presenting today in partnership with NNLM and very appreciative of their funding of our program. So I hope for you to walk away from this webinar with an increased understanding of how our library system this past year assessed staff capacity related to health reference, how we worked with the local hospital or medical library to provide consumer health reference training to public library staff, as well as some of the public programming we have done around consumer health information, most notably using the digitallearn.org module online health information. And as Liz said, feel free to put questions in the chat box as we go along, and Liz will bring them to my attention. So just as an overview, Nashville Public Library is a 21-branch system serving the close to 700,000 residents of Davidson County, Tennessee, as well as the individuals who drive into the county each day for work. The state of Tennessee consistently falls near the bottom of most state health rankings. And when looking at Nashville specifically, we have higher rates of smoking, poor mental health days, diabetes, physically inactive adults, and uninsured adults compared to national averages. And it makes perfect sense, as all of you know and why you're on this webinar, for a public library to align itself with these health priorities and to participate in efforts to improve health outcomes, since we are a key access point for so many community members. In late 2015, Nashville Public Library received a 3-year grant from the local health insurance company's foundation to enhance existing wellness programming and resources at the library, with a targeted focus on branch neighborhoods experiencing more health disparities. So based on input from community members and branch staff, we have been offering over the last 3 years different programs such as weekly yoga and Zoom classes, cooking series, meditation, music and movement for children, various health presentations, and anything that falls under this wellness umbrella. We rely on a number of mutually beneficial community partnerships who provide free or affordable programming and who bring a specific expertise to our community members. And we also open up the library space for different public health partners to do their work, such as during open enrollment season, navigators come and do health insurance enrollment for the marketplace. The Women, Infant, and Children program has monthly clinics at some of our library locations. And we also provide the summer food service program through the FDA for children who lose out on that free meal that they get during the school year. And so some of the photos that I've included in this slide demonstrate BeWell activities that we have done over the last year. From more traditional things like outreach to bring attention to our resources and programming at health fairs in the community, as well as programs promoting relaxation and self-care, such as adult coloring and crafting. We have partnered with the American Heart Association during the month of February to have blood pressure readings in all of our library branches, as well as opportunities for staff to monitor their own blood pressure with cuffs at each location. And then finally, my favorite photo, this was a program that we did at our main library where we brought a sound healer into the lobby of the library, and she played her gongs and singing bowls to anyone that was just walking through. So from the start of this initiative, we have been tracking a number of outputs and outcomes using a logic model to guide our goals. And as seen in this slide, the number of programs that we offer has more than doubled since starting this initiative 3 years ago. And in our targeted neighborhood communities, the programming has tripled. And we've been measuring outcomes through a program survey with a focus on satisfaction, behavior change, and access. And so the outcomes that I've listed here are from our most recent fiscal year. So really looking at health behavior change as an intention as a result of attending a program, and someone might say they're going to now replace more of their meats with plant proteins, or they'd like to integrate breathing exercises into their day-to-day, or maybe they plan to attend next week at weekly yoga. And I love to see that so many people intend to return in the future, which allows us to continue seeing the need for us offering this programming. And lastly, we really feel it's important to look at the accessibility of this programming. So we ask survey participants, was the reason that you came in part because it was free, because the location was convenient, because it felt safe, because the staff was welcoming? And over 98% of survey respondents said it was one of those things as a reason why, and the most popular response was because it was free. So up until early 2018, most of the focus of BeWell was on expanding wellness programming. And upon receiving the All of Us Research Program Community Engagement Sub-Award from NNLM, I started thinking about how we could better be promoting health literacy beyond wellness programming and in a coordinated fashion. And I am not trained as a librarian, so I really looked to my colleagues to learn more about our collection and reference activities in hopes of finding some baseline data. So such as, what does our day-to-day health reference look like? What questions are people asking? What health resources are we promoting to the public? What is in our collection? How old are our resources? And a lot of these thought exercises were prompted by attending the Stand Up for Health pre-conference at PLA in March of 2018, and the activities that we were asked to do to complete the Consumer Health Information Specialization. So as a result of those questions, I decided to survey our adult services staff across our 21 locations to find out more about the frequency of health questions, their comfort level with handling these questions, and their interest and willingness to receive more training. So 32 adult services staff completed the survey, and it was a representation of all 21 locations. And the following results, or some of the results I've put up here. So over half of the respondents said that at one point they did not feel confident when assisting someone with a health reference question, and really not knowing, am I crossing that line of giving health advice? I'm not a doctor, I'm not trained in this. Also, 30% had never heard of Medline Plus, and of the 70% who did, only 39% said that they had ever suggested that resource to someone in the public. It was encouraging to see that over a third of staff surveyed were interested in attending a training. They wanted more information, especially around what are trustworthy health websites. And then also seeing willingness of staff to separately track health reference questions if we saw at some point that that was important to do to generate some baseline data around what questions were coming in and how often. So with this survey feedback in hand, I went out to explore what our local sources of expertise were, and we actually have here in Nashville 3 medical libraries. And I reached out to all of them about partnering around health literacy work and assisting with our public library staff capacity around health reference. And those 3 medical libraries are Vanderbilt University, Meharry Medical College, and St. Thomas Ascension Health Network, which is a hospital system. And Meharry at that time was in the process of hiring a new librarian, and they just did not have the capacity to partner. The librarian at St. Thomas was relatively new to the field, and so together we decided a staff training was not the best fit, but we wanted to work together in the future. And then finally, Vanderbilt's biomedical library, they ended up having the most librarians on staff, and actually on their own, around that time they had been exploring ways to connect more with the community outside of the campus. So it really turned out to be a great fit to work together. So this is a photo of Philip Walker on the left and his team, who developed and presented a 3-hour training for Nashville Public Library staff based on our needs and interests related to consumer health information. And so the agenda we put together, we wanted to touch on just general outline of what is health literacy, wanted to focus on the health reference interview and the ethics of it and the RUSA standards. We also wanted to make sure that Medline Plus and other online consumer health websites were really featured and other free databases. And then touch on local health resources and service referral, especially related to what they might be doing over at Vanderbilt. So we had 25 staff come out and attend this training in person. We also held it in our computer classroom of our main library so that the training would be hands-on with the online health information sections. Vanderbilt generously provided boxed lunches for staff, which was a nice opportunity for public library staff, medical library staff to chat informally. And our Nashville Public Library's tech services filmed the training so that a recording could be available later for other staff who could not attend in person. And so as pictured here, this display I put together of local health resources, information on how to obtain the CHIS, the Consumer Health Information certification if they wanted to take it to the next step. I also had all of us brochures and fact sheets. And then my favorite part were I put together with our library button maker Medline Plus buttons so that you could show your new expertise in Medline Plus. And I had gotten that idea from a Spark Talk at PLA in 2018 where a library made buttons for each of their databases to wear on your lanyard as you developed proficiency in each of them. So I now have Medline Plus buttons that I give out at the end of programs and trainings. So at the end of the staff training, I had participants complete a survey to measure what they had learned. And I was really happy to see that staff reported increased confidence in all areas, which you can see on the screen here. The one thing that really opened my eyes, because this is my day-to-day and my sort of area of expertise is the community health resources and what is out there. So I was sort of shocked to see that no one felt confident about identifying local health services prior to the training. And so although there was some increase in confidence as a result of this training, I would like to do more to be continuously sharing resources as they come up and have this information more accessible at the reference desk. And one thing I did do was take, there was a document that came out of the Stand Up for Health pre-conference that NNLM put together of trustworthy online health information that has really been invaluable to me over the last year and a half. And what I did is adapted it to include local resources for Nashville and Davidson County. So adding what are the local crisis lines, what are the free STI testing sites and the free and low-cost health clinics, and then what number can someone call when it's not open enrollment to get assistance with health insurance enrollment. And in sharing this with Michelle Spotts over in NNLM, the Pacific Northwest region, she suggested, could you turn this sort of static page of links into a dynamic bookmark that could be at the reference desk that they could just pull up on their browser and have a drop-down menu of labeled folders to more easily access that information instead of relying on opening a Word document and finding a link in multiple pages of resources. And so I figured that out, and we now have an importable browser folder for your bookmarks with consumer health information. And we also have a staff intranet page that all staff can access. We can share resources. And so I added a Be Well at NPL folder that includes resources like the Be Well survey, contact information for programmers, our flyer template with funders, and now this comprehensive resource of online health information. So staff doesn't have to rely on emailing me for content. They can go right into this folder on the intranet and find some reputable health information and local resources. So the training that we held with Vanderbilt was in March. And so I checked back in 3 months later in July to see if any staff had used the training content. And one participant did report that they had not received any health questions since the training while working the desk, but of the participants who did, over half reported that they had directed someone to a title in our collection, followed closely by half directing someone to Medline Plus, as well as other reputable health websites. And it's interesting to me that this data sort of mirrors the new confidence levels as a result of the training, with still some either not total confidence with the local health resource referral, or maybe that the question, maybe the questions just didn't come up. But evaluating a health website being the less common, which would be more time consuming sitting down one-on-one with someone, but that it did occur since the training had happened. So beyond health reference, we have also looked for other opportunities to highlight health resources and health information seeking skills during public programming. And so this emphasis is also tied to the All of Us research program to generally be working to increase health literacy in the community. And so some of the focus areas that Liz mentioned with the All of Us research program are precision medicine, genetics, and citizen science. And so I really looked over this last year for some creative ways to highlight these topics that can be very intimidating, very sciencey, and maybe not relatable to the average person, and to also highlight the associated trustworthy resources, many of which I had not even known about myself, like clinicaltrials.gov or Genetics Home Reference. How can we further inform the public about these trustworthy and free resources that are available? So I've included some photos here of some public programming I did, trying to step out of the box around these specific topics related to All of Us research program in health literacy. And the photo in the bottom left with the spinning wheel, which I purchased specifically as a result of this new focus on health literacy, of what's one way you can make consumer health information more exciting and engaging is to capture people's attention with a wheel and a prize. So I used this wheel during a library community resource fair where I was doing consumer health information awareness, and used the wheel to ask questions about online health information. So one example would be you spin the wheel and you get the question, true or false, the first Google search result is always the best one. And so it's just this neat opportunity to have a quick teaching moment on a topic where maybe someone wouldn't have stopped and talked or picked up a brochure or learned more. They get a little piece of new information through a quick game with the wheel. And so another program that I did, and this was a focus on genetics, was the photo above of the creating a medical family tree. And I had learned at an MLA conference that creating your medical family tree is actually the best genetic test that you can share with your doctor, and it is free. So this program I ran as a public program, and I created the template that's in the photo here of an easy-to-use medical tree. You can also go in the Genetics Home Reference and build one out online and print it, but we just did this one by hand. And so highlighting the need to have 3 generations of family member health information, and also what information to include, especially if someone has died and whatnot. So the program was really set up around what to include, how to talk to family members, how to have discretion, and how to use privacy and confidentiality when creating this. But really the most fun and unexpected thing that came out of this program was because a lot of the participants, I'd say, were older adults, and in filling out their family tree in the program was the sharing of names of their parents and aunts and uncles and their grandparents, because there was a lot of names that you just don't hear anymore, and that was just really sweet and fun to hear people share about their families in that way. And I also ended up writing a blog post, just a very simple blog post for our library blog on the topic of creating a medical family tree. And it ended up being the most read blog post that month. And we have a variety of topics that get featured probably every other day a post is put up. And so I thought that was really cool in demonstrating people's interest in this topic area. And so the final photo that I've included on this slide was from probably one of the most successful events we did this past year. And it was just something kind of put together on a whim with the idea of, I really would love to be sharing the story of Henrietta Lacks, and how could we do this outside of a book club? And so on National DNA Day, which I believe is April 25th, we did a public showing at one of our branches of the film adaptation of The Immortal Life of Henrietta Lacks with Oprah Winfrey. It was an HBO film, and served brunch. So we did brunch and a film, and we spread the flyers out to community partners, put some flyers up in the branch, and around 40 people showed up for the event that morning to watch this film. And I also invited in another recipient of an All of Us Research Program grant through NIH, which is 50 Forward, which is an organization that serves seniors, people over the age of 50, and they actually do All of Us. They recruit and enroll for All of Us, which we don't do as a library, but they do. So they have peer ambassadors who are already enrolled, and they had a table, and they shared a little bit about All of Us to people in attendance. And then after the film, we had a facilitated discussion with the woman in the photo here is a bioethicist and a professor at Meharry Medical College. And she had actually facilitated discussions around this film and book in the past. And so she shared some of her knowledge and led a discussion among the group about this film and the topics of ethics. And this program was so successful that we decided to run another health film and brunch in June at the same location, and we showed the film Flint, which retells the story of the Flint, Michigan water crisis. And it was a film that was created by Lifetime, and it is excellent. It was great. Again, we had wonderful turnout, and we chose that film as well because it addressed another All of Us research program theme of citizen science, where community members were doing data collection on their own, and it also addressed race and class inequities. And we are looking forward to doing another film in September, and we're just going to keep this up because it seems to be a popular program. People are excited about it. They're calling and asking when our next film is. And so just another way to get health information and discussion going in a fun, approachable way that has food. So a final way that we have been promoting consumer health information is through the Digital Learn module, Online Health Information, which was actually created in support by National Network Library of Medicine. And so National Public Library has its own partnership through PLA with Digital Learn, so we can direct our community members from our website to a vanity site that we can go in and track their usage. And I believe it just recently changed where users do not have to create a login. They can just use the modules, and we can still track how many people are using it. And I don't have that information today as to how many people have used the Digital Learn online health information modules, but we do have that ability if we wanted to go in and look. And I really like these modules because they follow the best practice of adult learners succeeding most when they learn at their own pace. So I wanted to be able to promote this wonderful resource, but turn it into a public program where if someone wanted to attend and then complete the modules in that 1-hour time slot, that they could. So what I did was adapt the modules into a group program at a few locations during the year. And it was set up so that you come into the program, each participant had their own laptop or computer and a set of headphones. And so, I did a little bit of an introduction as to what we were doing, and then sort of got everyone to the first video, and everyone was off. So the idea is that we start at the same time, but everyone is moving at their own pace. So some of us would discuss the content at different breaks in the modules, but mostly the participants kind of went through them individually and knew they could stop and ask questions if they needed. And there's some wonderful hands-on prompts within the modules, but I wanted to take it a step further. So I added a couple more activities in the form of a handout, which you may or may not be able to read here, the screenshot on the left. And so how that worked is by the time they get to video 2 and they're learning about Medline Plus, it's asking them to choose their own health topic, look it up, see if they can find a video, navigate to a video on that topic if there is one. Can you find where it would say if there was a clinical trial? And then in the next video, you're learning about searching on different search engines like DuckDuckGo or Google. So take that same health topic and put it into the search engine. What websites are you seeing? And then taking that another step further in the next video and applying the evaluation skills you just learned to that same search you just did on the health topic. So looking at those 1 to 3 websites that came up at the top, how do they hold up when you look at the expertise, the accuracy, the currency of those websites? So at the completion of the modules, a certificate appears at the end if you're doing it on your own, and you can have the option of printing it. And I found out early on that everyone wants to have a printed version of that certificate. So I now have printed certificates that I bring ahead of time in case there is no printer, so that I can write in a name and give everyone a certificate. And then this is also an opportunity for me to pass out the Medline Plus buttons to the participants to show their proficiency in using Medline Plus. So even if your library does not have an official affiliation with DigitalLearn, you can still direct people to the digitallearn.org website where they can access the online health information learning modules as well as a number of other online skills learning modules to do on their own. So that is all that I have prepared for you today, and I really thank you for sharing this time with me. I'll open it up to any comments or questions, and if you would like to get in touch with me directly, please feel free and comfortable sending me an email, and I would be happy to chat more.
So I don't see anything coming in on the chat, but feel free to kind of put things in the chat. I just have a few last administrative details to go over today. Oh, so Rita asked, where did you get the Medline Plus swag?
The Medline Plus, honestly, the only swag I have is I really like the bookmarks. But I know you're only limited to ordering 50 at a time. And so if anyone from if someone from NNLM or National Library of Medicine is on this call, I would love to know how we can get more of those, or if the PDF is available that we can print them on our own. But they're really simple bookmarks, just promoting really the URL and the logo, and I love them. And then the buttons, I made those just printing out the logo and then creating them in the button maker. And that's the only swag I have at this time.
I'm doing some sleuthing on our website right now to see if those Medline Plus are available as a PDF. Let me see. Huh. You know, I can't even find it at the moment. I don't know if anybody, and Michelle says you can order more than one pack of bookmarks at a time. And I think that's really going to depend on what region you are. So Elizabeth is in our region, SEA, and I know other regions will have different capacity limits to that. So you can always reach out to your specific RML regional medical library to ask them specifically. And I will try to track down if we have that available as a PDF, and we can send that as a follow-up in our email after this presentation.
That'd be great.
Yeah. So any other questions? All right, so I just have a few more administrative details. Today's presentation was recorded, and it will be posted on the NNLM YouTube page as soon as possible. I encourage you to subscribe to the page, as you will be notified as new recordings are made available. You can also watch all the awesome webinars we host on a regular basis, and I'll share a link with that page directly to you now. Once the recording is available on YouTube, most likely within the next week, we will email everyone who pre-registered for today's webinar a link to that recording. So just a little promotion about what's coming up next. Our next upcoming webinar for the SEA region is Seeing Your Search, Visualization Techniques for Exploring PubMed Search Results. And that is scheduled for Tuesday, September 10th at 2 p.m. Eastern Time. This webinar will be hosted by Edwin Spur of Augusta University, and will dive into visualization methods to explore the aggregate qualities of PubMed results. So as always, details on registering for this webinar are available on nnlm.gov, and if you're interested, I will also drop a direct link to register for that class. So finally, today's webinar is available for 1 hour of MLA CE credit. Due to some last-minute shuffling in our office, we are still working on securing that evaluation link that will provide instructions on how to claim MLA CE credit and give your feedback on this webinar. To ensure everyone who attended today's webinar has access to the credit and to giving your feedback, your thoughts on the session, the evaluation link will be provided in our follow-up email. So thanks again for attending today's session, and a huge thank you to Elizabeth for your time, your insight, and providing, just kind of giving us a peek at what's going on at Nashville Public Library. I'll hang out for a few more minutes if there's any questions, but have a great afternoon, everyone.